Hello everyone and welcome to PEBC OSCE Case for today. Today we have a little bit of a complicated case. I got this case from one of my previous OSCE aspirants and this is more of a calculation case. We do want to make sure that whenever we have calculation cases, we want to use a rough paper, put down all the questions that the person or the agent may have for us, and do the calculations in a rough paper so that when we tell them the answer, it is in a clear and understandable manner. Today you have the door note stating a doctor is coming to get a recommendation regarding a mutual patient. Do as you would in your regular practice. Now again, you do have about 10 to 15 seconds to look at the door note, so you can process that it is a healthcare professional. It may be a doctor, a nurse, or another healthcare professional that is allied to the patient. And we can use our medical lingo in this case because they would be a professional, they would understand our thought process. And let's get started with the case. Now, once you go inside the room, that is when your time starts. You will see a reference in front of you on your OSCE table, as well as a patient profile, which is usually provided to you. You can give your barcode to the assessor in the room and have a seat in the pharmacist's area. Have a quick look at the references and the patient's profile before the agent comes into your room, which is going to be about 20 seconds. Once they do come in, don't forget to get up and greet them and introduce yourself, and so that they know that you have noticed that they've entered the room. Good morning, sir. My name is Tina. I'm the pharmacist on duty today. How could I help? Hello, Tina. My name is Dr. Kumar, and I'm working in this hospital. I just need a little help from you regarding a mutual patient's treatment plan. For sure, doctor. Please have a seat, and I'll be happy to assist you today. What are your questions for me today, and how could I help you better? So we have a common patient, Tina. Her name is, I think, Dawn Smith. She's 20 years of age. She is having some side effects from her current therapy of fluoxetine 20 milligrams every day. I'm hoping to switch her to the venlafaxine. I was hoping to see if there's any switching regimen that I need to do at all. For sure, doctor, I'd be happy to help. I can look into my reference for you, but before I do that, do you have any other questions for me? Yeah, just one more. I was hoping to see when I should reassess her for dose titrations of the venlafaxine in case I do switch her to the venlafaxine. How long does it take for her to stabilize on it? For sure, doctor. Thank you for your questions and coming here. I'd like to quickly have a look through her profile with you so I know that what I'm giving you, the information I give you, is the most updated information. Would you be okay if I go through the profile with you? Yeah, for sure. I think when she came into the hospital, she had the same medication profile as you have on your table, so I don't think there's any additions to it. Thank you, doctor, for confirming that. I'll have a quick look and I'll give you the answers. Now, when you look at the patient's profile, usually you'll see that when it's going to be a case which is more like a doctor-patient concern, you'll see that there's a very straightforward profile like in this one. The patient's name, date of birth, age, any allergies, and chronic medications have been listed. You do want to make a note that the doctor wanted to switch her to the venlafaxine. You can double check and ask him in case you have any questions, as the profile doesn't say that he wants to change to the venlafaxine. Now, we do see that she's taking fluoxetine 20 milligrams already, so she's stable on that. And she is 20 years of age, so she seems to be a perfect candidate for switching any sort of medications, especially because of side effects. Now that you are content with the profile, let's have a look at the reference. Now, this reference will be given to you at the OSCE station. Remember to use this reference and this reference only if possible, so that you don't give any outdated information that you may already have, and you give the answer that the assessor is specifically looking for, because that is what you'll find in this reference. You want to quickly scan this reference, and you can easily see from the general approach section where medication A is the one that is being discontinued, therefore the fluoxetine, and medication B, which is being added, which is going to be the venlafaxine. Step 1 states that we need to have a dose increment per week, spending at least 1 week at the average minimum effective dose for drug A, in this case fluoxetine, and the average minimum effective dose is 20 milligrams for this drug, and the patient's already stable on it, so this step has already been achieved. Step number 2 states we have 50% of the average minimum effective dose of medication A, which is going to be 10 milligrams of fluoxetine, and 50% of the average minimum effective dose for medication B, which is venlafaxine. Now, 75 milligrams is the full average minimum effective dose for venlafaxine. Half of that is going to be 37.5 milligrams. Therefore, step 2 states 10 milligrams of fluoxetine and 37.5 milligrams of venlafaxine for 1 week. Step 3 states stopping medication A and increasing medication B to the full average minimum effective dose, which means in week 3 we stop the fluoxetine and we increase the dose of the venlafaxine to the full 75 milligrams. Make sure to write these in concise points on your rough page so that when you do convey this answer to the doctor or the healthcare professional, it is in a clear, concise, and understandable manner. Also, if you look through step 4, it states that we need to reevaluate the patient in about 4 to 6 weeks so that we know how the patient is doing on that dose, as well as in case we need to retitrate the dose, any dose increases or decreases. So let's go ahead and let's formulate our answer, give ourselves a couple of seconds, and convey the answer to the doctor. Thank you for your patience, doctor. As per my reference, there is a cross-tapering regimen when we switch between antidepressants. The patient is already stable on fluoxetine 20 milligrams as per her profile. In order to change her or switch her from fluoxetine to venlafaxine, next week onwards, we would need her to start taking 10 milligrams of fluoxetine and 37.5 milligrams of venlafaxine for 1 week. The week after, we stop the fluoxetine completely and increase the dose of venlafaxine to 75 milligrams every day. You would need to wait for about 4 to 6 weeks to reevaluate the patient, that is Dawn, and see how she's doing on it. Also, in case you want to increase or decrease doses, there needs to be a reevaluation within 4 to 6 weeks. I hope that answers both your questions. Do you have any other questions for me, doctor? No, I think I'm okay. I appreciate your help today. I appreciate you coming and helping and asking me for any questions and concerns you may have, doctor. Please do not hesitate to reach out to me in case you have any further questions in the future as well. Thank you for coming in, and I hope you have a great day. Thank you, Tina. Thank you for your help. And then the doctor exits. So just a quick things, you do want to make sure that you're greeting when the patient comes in. You want to greet them and thank them for coming when they go out as well. Have the empathy, sympathy. Try to use the patient's name just to give a more personalized experience. And be very concise and clear in your wordings and your communication, because a lot of us come from different backgrounds, but we need to be understood very easily. Thank you.